like to speak about general practice, and as most of you know that I'm a GP working on the coalface, and I want to explain some of the changes that were recently announced for the senators here and for the public in general. Last Saturday, the Taoiseach and the Minister for Health announced some preliminary agreements for changes to contracts for general practitioners. And a full general medical services contract has been promised since April 2017, 2 years now, but assurances have been given that negotiations are slowly moving in the correct direction. But the increase of funding of £210 million over 4 years sounds impressive, but it might be slightly misleading. And given the pedestrian nature of the talk so far, any progress is welcomed, but I'd just like to explain how, in some more detail, how this money is going to be spent. I and many other GPs across the country have serious concerns regarding details of the agreement with the IMO. In 2014 alone, £219.8 million was cut from general practitioners, the funding to provide a service to patients, medical card patients. Capitation rates were cut in effect by 38% due to the expansion of entitlements to free GP visits. The government appears to be trying to play the same trick again by introducing free visits for 6 to 12-year-olds while not actually funding the policy. We have a trolley crisis because GPs are overstretched. For every €1 spent in primary care, €5 spent is saved in the rest of the health sector. And if a proper general medical services contract was negotiated with GPs, with midwives and with nurses, we could be in a situation where patients, we wouldn't be in a situation where patients have to wait hours on end in an A&E to be seen, and then of course been left in a trolley waiting for a bed. Patients would be seen before their health deteriorated to a point where they needed hospitalisation, and hospitals would not have to be used as a first point of care for patients who are unable to get appointments with GPs or a public health nurse. When I left Wales a number of years ago, there was a 4-week waiting list to see a GP. In Ireland now, it's looking like 1 week, and we used to have same-day access only a few years back. As of March 1st, 2019, just over 2 million people, or 42.6% of the population, have access to free GP care. And this step forward towards universality is a wonderful thing, and I applaud it and I support Sláinte Care. However, time and time again, the government has announced new healthcare policies without considering how to fund them. Hence, 80,000 people have waited 33 weeks for the result of smear tests. I have patients, Leader, who had a smear taken in August of 2018 and they still haven't received the result. They came in to us and said, "Doctor, where is my result?" I said, "I don't know." "When am I going to get it?" "I don't know." "Why do I not know?" "We've been kept in the dark." And this is a problem. 80,000 people waiting for smear test results. Rural and deprived urban areas cannot recruit young GPs because they're not going to rural areas and they're not going to deprived areas and urban deprived areas. And that means that this cohort of people are being disenfranchised, these patients. And the Department of Health can overspend their budget by £1.3 million without even taking into consideration the National Children's Hospital overspend. So I think that if we were to be serious about providing adequate primary care services across the country, and especially in rural locations, we need to look at putting the proper contract in place as soon as possible, the reversal of FMP cuts. And at the end of the day, this is about providing care to the most vulnerable patients. And the most vulnerable patients in this country are patients with medical cards who live in urban deprived areas and in rural areas where they cannot attract a GP to the area, and it's unfair. We see patients having to travel 30 to 40 kilometres to access a GP service. And I'd like, Leader, if you consider having a debate on this matter. I think it's one of huge importance. General practitioners are the frontline soldiers in the whole battle in the healthcare service, and I think if we don't have an adequate primary care service, we don't have a health service at all.